Today, dozens of celebrities and donors will join executive producer Bradley Cooper for the Stand Up to Cancer telecast. This fundraiser happens once every 2 years and raises millions of dollars for cancer research.
This week, we are focusing on what you need to know about cancer. Today, a look at the cancer diagnosis, the questions you should ask, and what doctors wish you would ask. Neurosurgeon and scientist Dr. Raul Johndale is here with his insight as a cancer doctor at City of Hope. Good morning to you.
Good morning.
So how do doctors figure out if something in our bodies is cancer? And are they always 100% sure? Because the scariest thing is to hear that diagnosis, and then if it's incorrect in some way, that's devastating too.
Yeah, absolutely. After 7 years at City of Hope and obviously coming here in the mornings with you, I've sort of been thinking about if I were the patient, what I would want them to know and the essential questions, because there's so much information and there's so much we're learning and there's so much stuff coming out in social media and media in general. So the first question you want to ask, the first essential question is, are you confident about my cancer diagnosis? So let's dig into that a little bit. When they get a biopsy or they take some fluid, it goes to special doctors called pathologists, and they look at it under a microscope. And based on the pattern and the architecture, they have to figure out, is this just aberrant normal tissue? Meaning sometimes, you get a callus on your hand, that's a growth. Sometimes you have tumors that are not cancerous. Okay, and then you have cancer. So based on that histology, which is the architecture of the cells, and sometimes some chemical reagents that they add, they tell the doctor cancer or not cancer. That's the first step that needs to be established.
And once there is a cancer diagnosis, when and how do the doctors figure out what type it is? And is this a moment where you say, hey, I just want to get a second opinion, or does that come later?
I think you want to get a second opinion when you have these, today's 3 essential questions answered. So the second one would be, what type of cancer is it? Now stay with me on this. Just because it's cancer, and just because they took it out of your brain, a biopsy, or just because they got it out of your blood, cytology, that doesn't mean that's where it grew. So sometimes women have a cancer in their brain, and when we do a biopsy and you look at it, you say, hey, this is weird breast tissue that's traveled up to the brain. So just because you have cancer doesn't mean we've established what type it is. So they have to tell you, yes, we're confident you have cancer. Number 2, we think it's glandular, so it's breast cancer. We think it looks like bone or muscle, so it's maybe a sarcoma. So they'll give you the type of cancer, and you can't make the assumption, well, they took it out of my thighs, so it has to be a thigh cancer.
Right.
So again, 1, is it cancer? 2, what type of cancer?
Okay, and then the different stages of cancer. What exactly do they mean?
So this is very important. Now, usually if it's where it started, so if your breast cancer started in your breast, it looks like breast tissue when the pathologist have looked at it, and it hasn't gone anywhere else in your body, that's a lower stage, 0, 1, 2, okay, depending on nodes and other nuances. If the cancer has spread to other parts of the body, yes, you have breast cancer, and we also see a spot in your liver, then that's usually a stage 4. There is no stage 5. This is very difficult to determine just after a biopsy. This is the one that patients have to be most sort of patient with, if you will, because that's where they do the full body scans. That's where they get the PET scans and the CTs, and they look to see has it traveled. So when you leave, the 3 questions you want to have answered are, 1, are you confident about my cancer diagnosis? Because not every tumor is a cancer. Number 2, what type is it? Is it breast cancer? Or is it brain cancer? And the last one, what stage is it? Parenthetical, how far has it spread, if it's spread at all? Those 3 things empower you to get that second opinion, to send emails to your friends, and then be ready for that next visit where you're going to potentially talk about treatments.
Well, very important information. Be sure to check out Dr. Johndale's Facebook page for updates on this and other stories. You can also follow him and the City of Hope on Twitter.